Well, hello, folks. Welcome to our October edition of our Dockside Chat series. If you're in the Twin Cities, you know that it's still warm. It's actually kind of almost a heat wave. It was supposed to be colder, but actually a little warmer today. So, Tom Gunderson and I have to decide, when we're going to call it a fireside chat again, Tom. I mean, I think, what was it, a year or two ago we had snow. So, it could have gone fireside today. It could have been right on the button there. So today we are very pleased in our medical valuation lab dockside chat to welcome Jenica McHugh from Accenture. As we've done this before, it's going to be about 30 minutes on the record with recording, and then we're going to go off the record at the top of the hour, and people can be as inventive as they want to be. Just as a shout out, this is all in support of the Medical Valuation Lab with our newest programs being offered overseas with a global medical industry MBA. So if you're curious about it, go Google Global Medical Industry MBA and learn more about our latest offering. So I'm going to hand this over to the very distinguished Tom Gunderson, one of our Valuation Lab council members and medical industry executive in residence, and generally awesome person. Tom, take it away.
Okay, thanks, Steve. So we're very happy to have Jenica McHugh with us today. She's a managing director at Accenture Technology Strategy, where she helps define the role of technology in healthcare. She's known for shaping how companies can use technology to disrupt their market through changes to business and operating models, M&A, and innovation. I just love that. I think this is perfect timing for a talk like this. My first question to kind of open things up, Jenica, is you've got a Bachelor of Science in Chemical Engineering. You did that with a double major in computer science. You started off in technology, sort of pure at Accenture, and now you're the go-to person on technology and healthcare. How did healthcare play into this? What were the pros and cons to jumping a little bit more onto the healthcare side?
Yeah, the opportunity was luck, but the real answer is why I stayed. So when I was going through my career at Accenture, and I had a little bit of a what I'll call my mid-career crisis. I've been at Accenture for 15 years, so this was about 6 or 7 years in. I had been working in our technology organization doing large implementations, and I got to the point where I really wanted to explore a different part of the world and the job. And so I was sponsored by someone in our health practice to transfer into our strategy organization. And that turned up to be just great serendipity, because as I discovered the world of health, I discovered an area that I'm very passionate about now. There's this joke we have at Accenture for our different practices. And health, we used to say our slogan was "Work That Matters." And it's a joke because, we're kind of giving shade for all the other parts of Accenture and implying their work doesn't matter. But, the real thing behind that is I advise my clients, and ultimately, what is the goal of every single one of my healthcare clients? It's to make healthcare more affordable and more accessible to all the people that we serve, and ultimately improve health outcomes. And so it's very rewarding to me to go into day to day and know that ultimately that is the goal that we keep front and center of everything we do. And it's not just about getting my job done, but making healthcare affordable and accessible for all.
Thanks. And before I tag team this back over to Steve, maybe we should define, so everybody's on the same page, how does Accenture look at the healthcare market?
Yeah, so we, from an organizational perspective, we break healthcare down into 2 sub-industries. So we talk about health insurance or health payers, and health providers, which is your academic medical systems, your hospitals. And so those are the 2 separate organizations, and people can specialize in either. I do work across both myself. And what that usually means is the type of work that we're advising our clients. On the insurance side, of course, it's going to be more on from a financial services perspective, better serving members, better providing the government care, Medicare, Medicaid, and getting that into the best way into the hands of the patients and helping them through that journey as they go through their life and go through different phases of their medical journey and need different types of insurance. And then on the health provider side, of course, we're looking at everything from diagnosis to treatment, and how do we help our clients provide the best care in a world where they need to be conscious of their business operations so that they can be financially keep putting the money towards where they want to, which is the doctors and the patients.
So we'll be talking about, and you're talking about technology and payers and providers. The third P would be product. Where do pharmaceuticals and med devices and those kinds of things go within biotechnology? Where are they lodged within the Accenture system?
Yeah, no, that's great. In the world of health, it's so large today. So we call life sciences. Life sciences, we actually advise clients. We try to group our offerings based on the type of advice our clients need and bring people with similar skill sets. So we put our product organizations, there's a different organization called products. And so pharmaceuticals, which offers drugs as a product, or medical devices, which is as a product. A lot of times gets served through our life sciences or product organizations. And then, I'll go couple other ones. You think of the full world of healthcare, we can talk about pharmacy benefit managers, right? And then you start to get into the retail, like the CVS's and the Walgreens of the world. And so those are served with the combination of our retail and our health practices. And then, the world of health continues to expand, because you can really say, well, what about Amazon and PillPack and the convergence that they're trying to get into healthcare? And that's under our commercial media technology, right? So the part of the reason that world of health is so exciting right now is, yes, I start small and say our pure health practice is this payer and provider, but I can probably go through any of Accenture's industries and say there is a role for a health leader in this, because everyone is a healthcare company these days.
Got it. Steve?
Thank you, Tom. So I think it'd be interesting just for you to talk a little bit about Accenture itself, because I mean, it's a fabulous organization. We're thrilled actually with the sponsorship that the Valuation Lab is getting from Accenture, and before that, Millie has gotten it too. Just tell us a little bit about the size of it, the scale of it, countries, because it always blows me away, and I think some people may not quite realize it, or even just the tiers of how people they come in as an analyst and they rise to partner or something to that effect.
Yeah, no, I love to talk about Accenture. So I've worked at Accenture my whole career. So I am definitely very passionate about the company. And my husband, who also works for Accenture, his joke is that I drink all the Kool-Aid, because all I do is talk about how great the company is. So we have over 600,000 people globally. So it is an extremely large company, over $50 billion in revenue. And when you think about how we go to market, we have 5 service areas, is what we call them. And so we have strategy and consulting, which is where I sit, which is our advisory services. We have technology, which is the organization that I started with. And that's the organization that's helping our clients implement technologies. In some cases, we even build our own technology products. We have operations, which is where we help our clients run their technologies. And then we have, a couple other ones too. It actually changes kind of often, so I sometimes get lost. But from a career path perspective, you mentioned the from analyst to managing director, and so technically we have what we call 14 levels. So you could work anywhere from 14 being actually the most junior in the company up to 0. 0 would be our C-suite, our CEO, Julie Sweet. I'm very proud to have one of Fortune 500's, leading, I think, 2nd or 3rd most influential women in business as our CEO. But the typical levels, especially in strategy consulting where I sit, is to go from analyst to consultant to manager to senior manager and then to managing director. And I'm a managing director. And if you really want to get to the details, which I won't bore you, we can get into sub levels within managing director, which is all behind the scenes. You don't see it as much.
It's very cool. And I guess one question, I guess that I think actually we talked about this a little bit before, but the notion of having work that matters seems pretty cool. But I mean, what excites about the culture of Accenture?
Oh, I love, so when I first started at Accenture, we had really almost recently been Accenture Consulting, right? So we were Arthur Andersen. We split off before Enron, before everyone gets confused, but before Enron, we split off, we became Accenture Consulting, and we went public in 2001. And so when I joined in 2005, we were still emerging from what it means to be a public company from a private consulting firm. And I think we've kept the culture since that time. We've always were known as the work hard, play hard company. And even as we expanded, when I started with 60,000 people to now there's 600,000 people, it's hard to keep a culture going when you have that type of growth. But I still find that the work hard, play hard is something that's persisted, and you're going to work with teams of people that know what it means to really be focused on what client value is and the type of work it involves to get there. But at the end of the day, especially when we're in person, which is a little hard now with COVID, we're going out for dinner or for drinks or, whatever it might mean.
Over to you, Tom.
So, Jenica, we had a little prep session maybe a week ago, and I learned a lot about technology with payers and providers. And since then, coincidentally, I've been in several meetings with healthcare product companies and one provider. And I was trying to explain exactly where technology fit based on what I'd learned in 10 minutes talking to you about Accenture. If I just look at what we've talked about, it's Accenture, technology, healthcare, overlap, boom, that's it. If you go to the web pages, you can read for the rest of the day, very insightful pieces, essays, surveys on healthcare and technology that Accenture has put together. But I get the sense that that's like number one with a bullet almost for healthcare at Accenture. Is there more to the healthcare consulting at Accenture? And if so, what? And if technology really is number one, how did it ascend to that position?
Well, I will have to say I'm going to represent my friends in business consulting and management consulting, because they certainly won't be happy if I say technology is number one. I will say Accenture as our competitive differentiator, right? Who do we look at as our competitors? It's companies like Deloitte and KPMG and PwC, and then in the strategy side we look at McKinsey and Bain, BCG. Right. What sets us apart? We are the premier leaders when it comes to advising our clients when it comes to technology. But part of the reason that we bring that value is we have within our practices and within our people end-to-end services. And so we have everything from the business strategy, which is going to be looking and advising our CEOs, our CFOs on how can they grow as a business, or in provider land where most of the time we're nonprofits. And so it's not focused on, margin expansion. It's how can we better serve patients at a more efficient and a better type of care, right? And then we get into management consulting, which a lot of time is on operational efficiency. And so there you're going to find different people at Accenture that work with doctors and nurses and the business operations side of things of clinical workflows, or data-led consulting, and how can we make smarter decisions with analytics and insights. And a lot of these, it's hard to talk about the world in 2021 and separate up conversation and take technology out of it and still get things done. So all of these practices maybe don't lead with technology, but technology is always a component, and it's very important that anyone at Accenture has that language, that fluency in technology. And I think it's just, what's your major, what's your minor? There's several people at Accenture that work in healthcare where their major is the business of healthcare, or a lot of ex-doctors come in with clinical experience, and they have to be able to talk not completely unintelligently about technology, versus my side of the world is technology first. And then along the way, as you heard my story, I picked up on healthcare, but I'm never going to be able to talk about how to treat patients, or HL7 in the same way a clinical doctor can. I'm never going to pretend to do that.
Got it. Steve?
It sounds, the thing that always strikes me about Accenture and working with folks over the years is that you folks really are many that keeps the modern healthcare system operating. I think, is that a fair description? Because if I think about United Health Group in particular, and I've worked a lot with them, they have a whole set of legacy systems. As my understanding is that without Accenture, those legacy systems wobble quite considerably in a technology support function. Because am I getting it right? There's some things that are very strategic, that are leading and coming up with ideation, and then there are other aspects of it that without you, everything falls apart.
I have the utmost respect for my clients, and I truly think that we are partners, and we are brought in for many different reasons. And I do think there's lots of successful companies out there that don't employ the services of a consulting partner. So I certainly wouldn't take credit Accenture on behalf of Accenture that we keep our clients up and running. That said, I think there's lots of opportunities that we can provide valuable services that it just wouldn't make sense for a client to keep on full time. Whether that is, how many times does a company really go through completely transformational change, pivot their business model, right? So you don't keep people like that just sitting around in case that's something you want to do someday, right? So let's bring in the consultant for this one-time thing, and they're going to advise us because they do this lots of times, and then maybe they're going to leave. And then the same thing on keeping it running. A lot of times we are available to do staff aug, or to bring in resources where the talent's hard to find. I think these days, talent's such a huge discussion, all our clients, but healthcare too, right? And again, I'm going to maybe go back a little bit to my mantra is always technology. So if you think of the best technologists, the computer science majors coming out of college, right? Most of them don't graduate and be like, you know what, my dream is to work for insurance company X. Like, man, that is just the only thing I've ever wanted to do. No, they're like, I want to work for the Amazons, the Facebooks, the Googles. So Accenture has a great brand where we can attract those types of people to work for us. And then when we do get the insurance company that maybe for whatever reason hasn't been able to attract that top talent, we can supplement. And then also a huge part of what we do is try to help our clients grow the talent internally. So it's yes, you can feed it the source systems from the universities like Minnesota, but there's also about putting in place the right apprenticeship programs, continuous learning programs, so that they can grow their technology talent as well. So I think I weaved a little bit from your original question, but to me, it all kind of fits together.
No, that's perfect. And actually, you kind of hinted at the next question, and I'll hand it back to Tom. Is like if you I'm an academic, and I work with students, and I train them, and I also engage with alumni. If as you see people coming in as you're onboarding, and I know we have some people that are alum that are Accenture now or want to think about Accenture because they're students. What's the skill set that we as academia, and sort of in Millie's great because we do academia and industry combined, like what should we be doing that we're not doing now in terms of training or recognition about different areas? Like, for example, I remember Susan Alpert, who's one of our executives and residents, our first, it's on this session, intoned to me over a decade ago, like, people coming to Medtronic, we used to what the MBAs knew what the human body was. And thus we created an anatomy and physiology for managers class, really to respond to the notion of it, knowing that. What would you say, what's our next class, Jenica, or what class actually doesn't matter anymore? Maybe the D-list one.
So I'm going to try answering it this way and see if this is going to fit with what you're saying. So when I'm going to talk a little bit about who are the most successful analysts coming out of school, straight from university at Accenture specifically. So consulting, let's got the world of consulting. And it's definitely the soft skills tied with the hard analysis and knowledge. And I say the number one thing advice I have to give to analysts is have an opinion. So what ultimately, if I had to boil the world of consulting down to one sentence, is we are paid to have opinions. And I get a lot of people come in and they're very good at following direction and they work really hard. And if it's like, if I tell them, create a slide, color it blue, and replicate that 20 times, man, they're going to do it right away. They're all over it. They got my direction. But it's the people that are really successful are the ones where you're saying, hey, I have this goal. I'm not quite sure how to reach it. Can you go figure it out? And they come back and say, you know, I thought about it and there's 3 options. And I think this one's the best option. And here's why. And I tell the analysts, I'm like, I don't care what your opinion's about. It could be, do I color the slide blue or green? Or should I, you know, have the order in this way? We don't need the opinion on how do I solve, you know, affordable healthcare. I'm not expecting you to know that. But so for me, for the business, and I'm probably speaking more towards business majors, and as I like engineers know how to think as well. It's people coming in that wants the world of consulting. We are really looking for people that can have an opinion and then have the people skills to share that and debate and influence clients ultimately.
That's great response. That's perfect, honestly. Tom, over to you.
So I early on asked you to define healthcare. I'm going to ask you to define technology. It sort of encompasses a lot of things, right? We're doing this on a Zoom call, so we all have some sort of technology available to us. But when you're going in and talking on a, let's just say, a big account about technology at a 500 bed, 1,000 bed hospital and working with them on technology, what are the 2 or 3 basics that they have to get is that before you can take them into the next level?
So first of all, I'm actually going to answer, I thought where you're going with this question, and then I'm also going to answer the question you asked. I thought you were going to have me define technology, and I was like, oh, this is exciting.
Do it.
You know, because it's actually way harder than you would think. I took a lot of philosophy classes in college. I'm like, oh, this is great. It's because, so I'll define it the way my clients talk about it. The reason it's so complicated is that usually you talk to a client and they want to define technology as in what do we put in our IT budget, right? Because to them, it all comes back down to the money. So if it's in our IT budget and we pay for it in this thing we call IT, then it's technology. And if it's not paid for that, then it's business or it's something else. But that's where it gets really complicated, especially as where are we going? Where is the world shifted from a technology standpoint across industries, but also healthcare in the past 10, 15 years? Is technology used to be this thing that kept the lights on. And the best technology organizations are ones you never heard from because things ran so well in the background, right? It's like the plumbing in your house. Like you never think about it. You only think about it at the pipe burst and then you're really pissed. You're like, oh my God, I hate that pipe. So technology was like the pipes. The shift we have now is all of so many industries, including health, is now using technology to face the customer, to go to market, to create revenue. It's not a cost center that's driving down costs. It is a revenue generator and actually impacting the way that care is provided. And for a lot of health companies, when they're looking to diversify their sources of revenue beyond their traditional models, they're getting into digital care and virtual care. And now technology is actually how you create your business. And so it is really interesting to talk to clients about, well, how do you define technology? How do you pay for it? Because there's anytime you're in the world of business, you can't separate the conversation from the money. And so anyway, so that's how to define technology. Now you did ask, what are 2 or 3 things I would tell a client? And it actually, what I just said kind of sets it up, right? So the first thing you got to do is keep the lights on. So again, no one's going to care about how fancy you have a house if the pipes burst and everything's leaking everywhere and the hackers are coming in, or whatever. So you gotta get the basics right, and you need to invest first in just keeping always on, always secure. And then the next thing you really want to think about is what is your, well, my favorite, what is the role of technology? What is the role of technology in your future as a healthcare company? Is it something, do you want to be the Mayos of the world and the more innovative and go to market with new technology products, or the Cignas with their Evernorth that offer platforms that bring together different health services, and that's how you generate revenue and that's how you impact your customers? Or are you more of a traditional healthcare company, and it's really all about the care that you provide, and technology is there to automate and enable that care the best that you can? And being able to clearly define which of those scenarios, and it's usually not one or the other, it's some spectrum in there, you want to be when you grow up, that is going to dramatically impact the type of recommendations I would give a client as far as what they need to do once they get past well, make sure you've invested enough to keep the lights on and keep things secured, stable, and so on.
Got it. Thanks. I'm going to hand it over to Steve, but before I do that, just a bit of housekeeping for those of you who haven't been on our calls before. We do these for 30 minutes, then we turn off the recording machine and get a lot more into Q&A from the audience. So if you need a little time to think of a hard question or just a question you want an answer to because you're curious, now would be a good time to start. Steve?
Sure. And this might be maybe this goes on off the record question. You could decide, Jenica, where it's like, let's table that to the recording being off. But so so a passion of mine, and this is like I'm curious to see like where Accenture is on essentially a demand that might be coming from your clients. So area that I worked on in government recently is the price transparency rules. There was the hospital one, but the one that's coming down the pike that is more interesting to me is the payer transparency rule, where the payers have to essentially provide a monthly flat file. Now, granted, the administration still has to, the Biden administration still has to clarify exactly what they want to do with it. But I can tell you that when I was in the White House, when the rule was first getting written, there was a lot of consultation about what would the plans do. And I always knew that hopefully some firm like Accenture would solve all their problems. So is this a top of mind conversation, or is it a wait and see?
It is a top of mind conversation for Accenture. We have an offering that we're crafting that we call interoperability, which is all driven by a lot of the government regulations coming from both the last administration and this one, to better exchange information and have things like the files that go between payers. So you have your health history follow you as you move from health payer to health payer. You have the health information, whether your doctor, if you travel to Florida and see a doctor in Florida and come back to Minnesota where you're from and then go to the dentist, right? Everyone wants to have all that information in one place. So interoperability is definitely an interesting offering that we are in. I see our clients reacting a bit across the board, probably more in wait and see than I see in leapfrogging and saying this. How Accenture likes to position it with our clients is they really can use this, and we would love this, right? As a catalyst, it has to get done. You'll see I keep hitting on money because it's the number one problem. What is technology? Technologists usually, the hard part to getting to what they want to do is getting the funding. The one thing that always gets funded are government regulations. No one ever debates, should we do that or not? So how do we take this government regulation that's coming down? It's going to require a lot of technology work to enable the interoperability and the data exchange. And could we use this as a catalyst to not just do the bare minimum to meet what the government is asking for, but actually turn it into a source of revenue or differentiation? And what kind of digital services can you build on top of that excites your members or excites your patients, so they want to use your company's services more than your peers? Because it's not just, hey, the government said I had to know how much this medical procedure was going to cost me within 3 days of me getting diagnosed, but it's in my app and it's there and it connects to all this other past history that is available because of it. I talk, by the way, I'm strategy, I'm visionary, I'm excited. I do have to recognize from my technology friends, this is really hard to do from a technical solution, the interoperability mandate. So I hope as everyone hears it coming, and then maybe you're like, why is this taking so long? Data is so complex in the world of healthcare and incredibly siloed. So the regulations make so much sense. It is just very hard to implement.
Yeah, no, I think it probably would have been far easier to implement if it was done 20 years ago, like when PBMs first got built and you could build it from a greenfield to kind of have that interoperability work for them for retail pharmacy, but to do everything retrofitted after at least 5 different EMR installs. But we are at time. So this is a perfect segue for an off the record conversation. So I am going to let me officially thank you, Jenica and Tom, for engaging in this conversation. I'm going to turn the recording off. This recording will be made available on the medical valuation site, and you'll see a link there probably in about a few days.